Clostridium difficile is the topic for this video. Clostridium difficile is a gram-positive bacteria. It can cause diarrhea, and this is really the big disease process that we're going to discuss. And there's a couple other terms that Clostridium difficile induced diarrhea is referred to as. One is antibiotic associated diarrhea, and the other one is pseudomembranous colitis. We'll talk a little bit more about these. I mean, essentially it's the same thing. When you say antibiotic associated diarrhea, why is it called that? Well, I'll explain that to you right now, and then at the end I have a vignette for you. Well, the first scenario is we're just going to draw a colon here. Okay, just a segment of the colon, and I'm going to use the purple here to sort of represent the normal flora. And what I mean by that is bacteria that normally live inside your colon. And then I'm going to represent, what color do you want to use? Orange? Sure, why not? The orange represent Clostridium difficile. And there's two scenarios. There's this one, and then there's the second scenario in which you actually don't have any of the C. diff. And I'll try my best to explain what's going on. Okay, this is also normal flora. Okay, the first scenario, this one right here, is a scenario in which a person has normal flora in their colon and also has some Clostridium difficile bacteria in their colon. A small percentage of healthy adults do have this Clostridium inside their colon. Now, this is when the disease pathology begins. A person is given antibiotics, okay, for whatever reason. The most common antibiotics that cause this diarrhea are cephalosporins, okay, cephalosporins, penicillins, in particular ampicillin and amoxicillin, clindamycin, remember that one, and fluoroquinolones. So the person is given antibiotics. Well, what does the antibiotic do? The antibiotic is given to treat the infection, but it wipes out their normal flora, but it doesn't clean out the Clostridium difficile, and as a result, the Clostridium difficile is now alone and no longer has the competing bacteria, and as a result it proliferates. And once it starts to proliferate, it basically causes this diarrhea. And the reason it does that is because it secretes a cytotoxin. And those cytotoxins are basically, and enterotoxins also, these toxins, essentially what they do is they secrete fluid and develop these characteristic pseudomembranes. That's why it's called pseudomembranous colitis. And that pathology eventually leads to diarrhea. Now, what's the second scenario? The second scenario here involves a person, most commonly like 90% of the population, that doesn't have any Clostridium difficile in their colon. They just have the normal flora. So the second scenario is somebody that just has normal flora, and then they are placed on antibiotics. And then, as we did with the previous diagram, the antibiotics clean out the normal flora. Then the person, most likely in a hospital setting or a nursing home, is infected with C. diff, Clostridium difficile. How are they infected? Well, the most common way is a healthcare worker, usually like a nurse who hasn't washed her hands, because a lot of these settings, these environments like nursing homes or hospitals are places that there's a lot of bugs, and sometimes those bugs can be transferred from a healthcare worker to a patient. So this person is now infected with the Clostridium difficile, and their colon has just been cleaned by the antibiotic, so there's no competing bacteria for this Clostridium difficile, and as a result it flourishes and causes this overgrowth, and then these toxins are released, and the toxins eventually lead to a form of diarrhea. Okay, so that is essentially what's happening. So now that we have an understanding of why this happens, let's talk about the symptoms. Well, the symptoms, like I mentioned, is diarrhea is the main symptom. It's frequently watery. It can also be associated with abdominal pain and tenderness, what you would expect. So we can go right into the diagnosis. So the diagnosis really is a combination of sort of getting a good history. Were you on antibiotics recently? Were you in a nursing home recently? Did you go to the hospital? The person's probably in the hospital when you're asking the questions. So after the history is obtained, the main test is you do a stool. You test the stool for that toxin that I talked about. And it's that C. diff. I'm abbreviating Clostridium Difficile by writing C. diff. It's done all the time. This is the main test. Stool test for Clostridium Difficile toxin. Some other times you might also want to do a sigmoidoscopy. This is sort of a short form of the colonoscopy, where you just look at the sigmoid colon, because you want to maybe visualize those pseudomembranes that these toxins are responsible for creating. They're yellow-white plaques. Yellow-white plaques that you would see. You might be able to visualize on the sigmoidoscope. You can also maybe do a stool WBC count, white blood cell leukocytes, which will be elevated, but that's not a very specific test. How do you treat it? You're doing what caused it in the beginning. You have to give it an antibiotic to treat this. I know that's a bit confusing, but it is what it is, and the antibiotic of choice is metronidazole. You usually don't have to know dosages for licensing exams, but I'll just write it. 500 milligrams 3 times a day times 10 days usually. And if the person's on metronidazole and they're not getting better, they don't respond, the big gun is vancomycin. Vancomycin is the stronger one, but you give this one first. Okay. And I just want to mention one final thing. Infection control measures are really the main way to reduce the spread, and in particular hand washing of healthcare workers so that they don't spread it. You really can't do much for the small percentage of the adult population that has Clostridium difficile as part of their normal flora, but the other 90% or more that don't have it, you can prevent them from getting it by infection control measures, most commonly hand washing. And to finish off the presentation, I have a clinical vignette. So here we go. 86-year-old woman with hypertension, non-insulin dependent diabetes, coronary artery disease, and a history of tonsillectomy as a child comes to the office because of 1 week of watery diarrhea. She has been in relatively good health except for a tooth infection for which she had recently completed a 14-day course of clindamycin. She reports some subjective fevers and chills, but denies significant abdominal pain. Temperature is 38, blood pressure is 110/70, pulse is 95, respirations are 12. Physical exam shows dry mucous membranes, anictoric sclera, mild left lower quadrant tenderness without rebound or guarding. Bowel sounds were increased. Rectal exam is heme negative without obvious masses. The finding that will most likely establish the most likely diagnosis is... Alright, so we got angiography revealing decreased blood flow to the superior mesenteric artery. Well, that seems like a bit of a long shot. Detailed travel history and exposure to people with similar illnesses. Well, that sounds like a good option. We'll keep that one. Obstruction series showing dilated loops of small bowel with air fluid levels. Well, that's a bit of a stretch, so I'm going to scratch that one off. Sigmoidoscopy showing diffuse friability, pseudopolyps, ulcerations, and bleedings. Well, that's also kind of along the line of further diagnostic maneuvers or testing, and I'm going to scratch that one off. Stool exam, positive for bacterial toxin. Well, I'm going to keep that one. Really, on licensing exams, you're looking for the best option, right? So if you get confused between two, what's the best option? Look at this question. It's exactly what I talked about in the presentation. You know, a patient that had antibiotics, okay, and then a few days later, in this case it was a week later, she comes with this diarrhea. And at this point, you know, it really is a classic case. I mean, even if you look at the antibiotic, clindamycin, the classic case of pseudomembranous colitis or antibiotic-associated diarrhea or Clostridium difficile induced diarrhea, whichever one you want to call it. It's that. And the way to diagnose it is E. You do a simple stool test for the bacterial toxin that is produced by the Clostridium difficile bacteria.